Our final speaker is Dr. Bernard Lewandowski, who is the CEO and Medical Director of Maryville Medical Imaging. He's also Associate Professor of Diagnostic Radiology at the University of Ottawa and a member of the active staff at the Ottawa Hospital. Please welcome Dr. Lewandowski.
Thank you very much. I'm short on time, so I just want to thank everybody for organizing, everybody for showing up. And I'm going to move on. Deb Matthews framed an issue that said that the doctors are making too much money. And that's what she's quoted on. That's all the ads here. Doctors make too much money. Well, she may be correct, but she's totally disingenuous in saying that. She framed two issues, and there are two issues here, and I'm going to spend some time on one of them. The two issues are: there's a professional fee. I work in IHFA, which is an independent health facility governed by the Independent Health Facility Act. So Maryville Medical Imaging, Dr. Nisnik's clinic, have to follow all the statutes and everything else of this act. So, forget about my professional fee. If I'm making too much money, I'll swallow some. But what they also have not told you about, if they're changing the technical fees substantially. So, at the same time, she says there's no change in service will happen. And her answer to that is because computers make things go faster. Okay, so let's try and debunk some of this. There are two fees for the clinics, the professional fee and the T fee. The T fee, or the technical fee, is supposed to pay for the rent of the clinic. Well, the rent's not changeable. By the way, the rent's increasing. Our lease ends in 2.5 years. I've already told the landlord if the rent goes up, we got to close. Okay, staff. Well, yeah, you can. We already heard, but you can skimp on staff, or you can get untrained staff. Most of us here have very high standards. All of us here have very high standards, and we not only get trained people, but we pay money to train them and get them extra education. So that takes care of staff. Equipment? Sure. Well, diagnostic radiology is very hard to understand. It is the most expensive form of medical care that you can get. Hospitals don't like this because we eat up the budget. It's very, very expensive. It's high cost, and it's high to maintain. Well, we can get cheaper equipment, or we cannot replace it every 3 or 4 years, or we can just not have maintenance done on it. An essential thing in imaging is the better the picture you have, the better the chance you have of finding the disease you're looking for. So, these are some of the problems. So that's kind of impact. What would happen? Our IHFA sees 300 patients a day. That's about between 66 and 70,000 patients a year. We have about 13 ultrasound machines plus other machines. If we close down, and Dr. Nisnik's lab had to close down, and we're just only part of this whole system, where will all these patients go? During the SARS epidemic, the IHFAs stayed open. The hospitals closed. Just remember that. Now, what about the decrease in fees? Very hard to tell you exactly because everybody's confused about how much decrease there is in fees. The bureaucrats can't tell us, but on the average, for the next 4 years, there's going to be 8% decrease in the technical component. There has been no change in our overhead fee for the last 20 years. Costs have gone up and up and up. There's going to be a further significant decrease. Now, the decrease is not the same across the board. The decrease also affects elderly patients because the tests that are being killed are those that have to do with vascular disease, heart disease, and cancer. There are at least 10 patients here that have cancer, probably 5 of which are undergoing active treatment. What will happen? Well, in order to do your test and to still stay alive, I need some water. And to stay alive, we will have to decrease the time that we do your test. Well, nobody likes to be just brought in, so a little bit of scan and out you go. Some of our tests take 45 minutes. Well, we would have to decrease that to 30 minutes, maybe even 20 minutes. Say hello, okay. So now if you have cancer, and you've had some treatment, and you want to find out whether your tumor's gotten bigger or smaller, it takes more than 20 minutes to figure that out. It takes more than 20 minutes to figure out whether you have new spots somewhere else, etc., etc. So in fact, if we shorten the time to do it so that we can stay alive, we will miss things that will directly affect yourselves and your treatment. So to say that there will be no change in service is absolutely ridiculous. Now, so that takes care of things can be done faster because of computers. Also, the cost of computers is much higher, and the costs are unbelievably high. So now, will we have to close? We won't have to close tomorrow, so we don't have to be on a contest as guess to who's closing tomorrow. But in 2.5 years, if things don't change, we will have to start to wind down. And so will many of the other imaging clinics across this province. It's hard. It'll take 2.5 years to do that. Maryville Medical Imaging employs 85 health workers. We opened in 1987, and we're probably the largest independent health facility in Ontario. That's all I've got to say. Thank you for your time.